I've got Douglas Ross, Conservative MP, here in the studio. Douglas, listening to that, how do you respond?
Well, I'm still unclear what the Labour government's position is in Wales. The First Minister is saying they could close the borders, yet the Health Secretary is suggesting that's not going to be an option. And
well, he wants legal restrictions to travel, not just from Liverpool, but perhaps also Nottinghamshire, the North East, anybody travelling to Wales, probably heading there for half-term.
But the reference that this was able to be done before was at a time when, I mean, if you walked around London, you barely saw a car. This was when there was a national lockdown and no one was travelling, so it was very easy to identify the very small numbers who were. We're now suggesting that if you close the border, what about people who live in Wales but work in England, or live in England and work in Wales? What happens to them? And it just seems a very unclear message, and I didn't get to the bottom of what the position with the Labour Party and the Labour government in Wales is.
Vaughan?
Well, that's a deliberate misunderstanding of the position. And we can either have a sensible conversation, we can pretend that things are being said when they're not. The ability to travel for work between areas where people do work, we have never restricted that. Essential travel for work has always been permitted, apart from at the start of the March lockdown. We were talking about the state and local rules we had in place through a good part of the summer when other travel was permitted. This isn't that difficult. Our police were able to enforce the rules and people respected those rules. This is about whether we're prepared to act to keep people safe with very clear evidence that we are seeing importation of coronavirus from high prevalence areas within the UK. And of course, we've done this already with international quarantine measures, where every government within the UK agrees on a series of measures because we recognise that in the higher prevalence areas in other parts of the world, there is a risk of COVID being re-imported into our communities where there isn't the same extent. And of course, we've seen direct evidence of that importation from Greek islands and a range of other holiday destinations. There's a very clear logic about how all four governments have behaved up to this point in time.
Douglas?
But I still think the message is unclear. Are you in agreement with the First Minister of Wales that you can and will close the border, or are you saying you don't want to do that because there are other measures that can be introduced before that?
No, what I'm saying is that I think that every time when people talk about closing the border, it's a deliberate flag. And it's really about saying at the border we could stop people from high prevalence areas. This isn't about saying this is about England, it's about high prevalence areas in any part of the UK, and that's the point. Because if you look at what we've done in Wales, we've intervened at an earlier point than England has to try to have restrictions in place to help keep Wales safe.
All right, Vaughan.
And that's really important about the message we have about the need to do this and the risk in not doing so, as we see in all other parts of the UK and in Wales, where measures are now required to intervene even further into people's lives.
How long has the Prime Minister got to respond?
We really need an answer this week, because otherwise we'll have to introduce our own measures. And of course, the Prime Minister has given interviews but not responded to the previous letter from the First Minister. And I do think it wouldn't be that difficult for him to put pen to paper and provide a proper response and rationale. Why not? In yesterday's meeting, some UK ministers claimed they weren't aware of evidence about the spread and importation of COVID from high prevalence areas to lower ones. So we're going to provide some direct evidence together with the First Minister's letter, and we look forward to a rapid response.